I think the public health dental hygienist is the next step.
In private practice, you may not see the underserved population the way that I see it in the school systems.
We can take the skills that we've learned as a hygienist and apply them in a different setting.
I think there are many hygienists out there who would really love the opportunity to be in a non-traditional setting with all of the challenges and rewards.
Legislation was recently passed which allowed, or actually created, the role of the public health hygienist for the first time in the state of Massachusetts. It allows public health hygienists to be able to deliver care without having to make sure that there is a dentist on site, which allows more freedom.
A public health hygienist is someone that has chosen to take the skills that they have developed over their career and bring that to an alternative setting.
Basically, what we're trying to do is reach a population that is considered the underserved populations.
The program that we do here at this school and other schools in Springfield is a prevention program. So what we do is we screen the children, we do fluoride varnish, we do sealants when they need sealants, and then we have a case management referral program.
Sometimes we have to make a follow-up phone call to the parent in regards to the child if they need dental services. And when we make that call, not all families speak English, and that can be difficult because you're not always certain that the parent is understanding your message. And in some cases, we may require an interpreter.
For some students, when they had this opportunity, when they were selected, it was their first time receiving dental services at all. It was the first time anyone had asked them to open up and let me see what's going on inside. And they were very excited about that.
When I came into the schools, they told me that the key to these programs is the collaboration with the school nurses. And I knew that was true, but I didn't know the depth of that relationship until I got here. In the schools that I serve, when the school nurses are really enthusiastic and when I have a great relationship with them, the program is so successful.
The oral health program here follows our policy that we have also in the city of Springfield, where we want the children to have the best education possible. If your mouth doesn't feel good, you're not going to do well in school.
You have to establish a relationship with the principal, with the nurses, and you have to build that relationship so that you can come into the schools and provide your program, but you need to understand that first and foremost, education is the priority in the school. Dentistry or the dental sealant program is secondary.
A lot of times we'll get into a school and there's testing. Not just MCAS testing, but any kind of testing in a certain grade. And so you may come in fully prepared for your day only to find out that you can't be there that day. And you have to be accepting and you have to be flexible and you have to work with the school to make sure that you can get in another day when it's better for them, not necessarily for you.
Sometimes you're in a very small, tight space. I actually work in one of my schools outside of a gym. And I have to put barriers up outside to protect the patient's privacy, but the space is small and tight. As long as you have an outlet, you're all set to go.
The equipment that we use in the schools is very heavy. The black unit that we have, which carries our suction and all of our equipment, is about 70 pounds. And it packs up nicely into a square suitcase, but it has little wheels, it's very difficult to drag. And in a lot of the schools that I'm in anyway, some of the schools are over 100 years old and they have no elevators. So we lug that thing up and down the stairs and it's quite cumbersome.
Putting it in the school, the kids view it as a part of the school, the curriculum. They weren't petrified, they weren't afraid as if they would be in a dentist's office.
You've got to be open to looking at the evidence-based dentistry that exists and incorporating that into your practice in the school. So it isn't taking what you've learned in private practice and bringing it to an alternative setting. There are a lot of things that you need to learn and that you need to keep up on, which is very recent data, that will help you do your public health hygiene job.
Sometimes I'm seeing children that have never seen the dentist before, have never been to a dental office, so this is an opportunity for them to receive a service. And if we can seal their teeth and prevent them from ever experiencing decay, that's a great thing.
Sullivan Middle School is certainly a better place because of the program that Paula has infused in our school, and and what makes it a better place is it has become a part of our school culture. It's not an appendage, it's not an addendum. It is what we do, and it's just another wonderful service that we offer. So it makes Sullivan special.
I think this is probably one of the most rewarding things, is it allows an independent person who's a self-starter to get out there and sort of set up their own day and also be able to regulate themselves as they practice. They get to make decisions about the treatment and the treatment plan that they're going to deliver. Certainly, the other part of it, or the other component of it, is that it's public health. So your variety of patients that you treat and the type of care that you can deliver and the fact that you're there to deliver that care, I think, is incredibly rewarding.